What can caregivers do? Again, the ladies talked extensively about a lot of this, but again, wear masks, useful in decreasing the spread of influenza and you contracting it, worn by the patient and or caregiver, particularly if you're within 3 feet of someone sneezing and coughing. Gowns and gloves not recommended for providing care in the home. We do still gown up, right? You still do gown up? Okay, thanks. I should probably read those emails. We do gown up in the hospital, but it's not recommended at home, certainly. And one vector of infection for this may be also particles shed in diarrhea. Okay, so you got to be aware of that as well. Keep the patient, again, separated from others. Try to stay in one room with the door closed. Maintain a 6-foot separation from others. Kind of think of it as, you know, they're bad humors. We don't want the rest of us to get it. What else can we do? We can keep the person as comfortable as possible, well hydrated, keep tissues and trash bag within easy reach so they're not having to get up and out of bed. For those of us who've had influenza, I've been very lucky, but again, I see a lot of patients, they are just sick, dog sick. I mean, they can barely move, they're miserable. And make sure that we're avoiding alcohol, smoking, ibuprofen and Tylenol for fever, sore throat, discomfort. Do not use aspirin in children or teenagers because of what's called Reye's syndrome. It's a liver disease, causes rare liver failure, aspirin and influenza. Weakness or unresponsiveness, sunken eyes, dry mouth and tongue, skin tinting, decreased or dark urine, particularly in children, young children. If you ever touch their soft spot and it doesn't rebound real well, then that's something that may be a sign of dehydration. Certainly in little kids, their reserve is far less. Their lung function is, lungs are smaller. They cannot actively work on their dehydration. So, the rules for all of us kind of fall into here, but clearly we need to have a closer, a more itchy trigger finger, so to speak, with the little kids. So, when they're under the age of 1 year and they're not actively walking around with water in their mouth and they're drinking, and those are the kids get hit harder by these kind of diseases. So be real careful with the little kids. Give sips or spoonfuls of fluids frequently. Watch for an increase in urination or lighter color. So ideally, in a normal person with normal kidneys, we should be producing approximately 30 milliliters of urine an hour. Okay, so we may not be voiding it every hour, but certainly you can think of that's the kind of amount of a normal urine flow. So when those people have really dropped off or the urines were very dark, that's a sign that they're not getting enough fluids. Watch for improvement in overall condition of the patient. Again, dehydration in infants and elderly can be dangerous because the reserves are less and it's harder to get back there. Particularly in children, their surface area is large compared to their mass, so they tend to lose a lot of fluids quicker. When to seek emergency care. Difficulty breathing, so if you're coughing, wheezing, turning blue, kind of doing this sort of deal, the opening up of the nostrils to get extra airflow, they're coughing up blood. I mean, that's a rule. You cough up blood, you probably should be in the ER regardless, but shows signs of dehydration, against what we were mentioning, that are severe. We all get dehydrated at times, but are you able to catch up? Does not respond or appear confused, or complains of pain or pressure in the chest, has convulsions. So there's approximately 4 children who've had seizures because of the H1N1. 3 of them had abnormal EEGs showing that they did have indeed seizure activity, and all of them, they recovered fine. But again, seizures have been reported. Getting worse again after appearing to improve. Because again, if you look at the symptoms of H1N1, it's like everything else. There's a lot of things that look like this. So clearly, if they're not getting any better, and we know that in the typical course of influenza, they should be getting better, those should be evaluated. In an infant younger than 2 months old with fever, poor feeding, urination, less than 3 times per day, or other signs of illness, I would make the argument that 2 months should probably be more like 4 to 6 months. Okay, so even older than 2 months. If you do get sick, if the ill person must leave home for medical care, masks. Michael Jackson made it fashionable. No reason why we can't either. So place the mask over your mouth and nose upon entry into a medical facility, and they do really push that here. Because again, I think we have a responsibility, because this is a focus of everyone who's sick in this community. I think it's our responsibility to keep You should not be more sick when you leave the hospital than when you came in. Get seasonal vaccines for the regular seasonal influenza, because statistically, if you're older, it's more likely to kill you than the H1N1. Identify those in your household who are early targets, so healthcare workers, pregnant women, the sick, the older folks, the young kids, particularly if they have other underlying medical problems, and the higher risk for the serious influenza, and then get the H1N1 vaccine when available. And again, you know, there may be the issue here is, yeah, these viruses are mutating, but the reality is we may find that if you're getting regular vaccinations, that the next time this comes around, it may not be such a big deal for you.